What's up, guys?
Today we are at our 30-week appointment.
30 weeks is
we
crazy.
Got about 10 more weeks to go. Last appointment we took the glucose blood sugar test, and it was not so great news. My sugar was a bit high, but I mean, they give you a sugary drink, so what do you expect? A drink that I never drink anyways.
Yeah.
We'll see what the update is and keep you guys updated.
See you guys in there. So now here in the office.
Little bunk date.
She's growing, y'all. She's really growing. Let me get a side view. She's growing.
I will control diabetes or not. The baby will do what you want to do, which is get ready for the delivery.
Right.
We just want to make sure we keep the baby healthy as possible.
Exactly. I do feel a lot of pressure in my pelvic area and tummy these days.
Alright, so baby, the heavier the baby gets, the more pressure you feel in your pelvis, okay?
Okay.
So tell them to get ready, refer to Dr. Jice, and just go diabetic management in pregnancy. Have you seen any high-risk OB doctors or any member of your family seen any high-risk OB doctors in the past?
I just know my grandfather on my biological dad's side did have it, but I'm not too connected with that family.
Oh.
That's all I know.
So your baby is weighing 3 pounds, 13 ounces.
Okay.
So diabetes made them big sugar, they get really fat quickly.
Oh, so is that weight normal or abnormal?
If you look at it here, no, just a little above average.
Okay.
So that's what we call the growth chart.
Okay.
So we're charting the baby's growth every time we do the ultrasound.
Okay.
So even when the baby comes out too, that's what the pediatrician will do.
Okay.
The baby comes out, they measure the height, they measure now. At 4 years old, at 3 years old, they chart the baby's growth to see that baby's growing appropriately.
Alright, guys, we just got done from the appointment.
And we got some news that because my sugars are quite concerning, our baby is slightly above average in weight.
Just poquito.
Yeah, they're not below weight, but they're not super high in weight, but they're like just slightly above the middle average.
And to me, that's okay. That's perfectly fine, because it's okay to have a little bit of weight on you, honestly. Everybody needs to, you know, have a little bit of weight, you know? So we just got to get her eating better. And that's on me too. I got to be more strict on her too. So, yeah. We
didn't really get a good picture. The last 2 pictures have not been so great. But
I think that's her head.
But an update would be is we have a 45D ultrasound appointment on Thursday. I booked it because I wanted my siblings to be there with us, and I just want better pictures of our baby. You know, I also want to see them in high def. It's not gonna look like this. It's gonna be like, whoa.
Let me get some zoom in action. Yeah, you guys can tell that it just looks like a black hole.
I don't really know what I'm looking at there, but
it's her head.
And then also, it's so weird. I know like most girls to get like multiple pictures, but our doctor doesn't do that. So another reason why I scheduled that 5D 4D appointment, just so I can get like a bunch of pictures, like a whole roll in high definition, and you know, just more of quality time seeing baby. I feel like here at these appointments they're a little bit rushed because he does have a whole
like a lot of people
a whole lot of patients to get to. So that's the update on our 30-week appointment. So far so good. Could be better, but we're not at our worst. So that's good.
But this is just making us be more focused and more aware of what we're eating, because we are eating for 2 now. you know.
And it doesn't help that I'm from the Hispanic side, and then of course from like,
you know,
everything, we both in our lines of family,
our people don't really eat healthy. Okay?
Diabetes is high in both of our races.
Just straight up, just saying it straight up. Yeah,
that doesn't help us.
It doesn't help us, and it is good, but it's
and
hard.
This man clearly loves candy.
I can eat candy. You can't eat candy. I can. I just hate that she can't, and I need to stop eating candy in front of her. So that's what that's really what it is.
Look, you in trouble. That's why the alarm,
No, it wasn't.
siren went off.
They ain't coming for me.
No, just kidding, guys. But that's about a wrap for
It's
this.
gonna be you guys see when we post videos. We don't really post videos frequently because we post authentic videos. Like we post videos that we want to post, you know. So we don't really have a set schedule on posts. We're pretty busy right now as with everything that's going on. We try to record our
daily
daily lives, but you know,
but ain't really much to life when you're an adult. You just work and sleep and eat.
When you both gotta hit 40 hours a week, it's really kind of hard to do stuff for the YouTube
to pay them bills.
Yeah, but at the end of the day, this is why I'm saying, like, we like posting authentic videos, and we like posting when we want to post. So if you guys really like us, go ahead and hit us with the like and the subscribe, and let us know about how you feel about about our results right now. And then, yeah, peace.